I will never let a patient die alone. If it is up to me, I will go in. I will do everything in my power to make sure that they know that there's a voice there because I think that is so important. Just the humanity of it and not just room 1301 is DNR. Strong boundaries doesn't mean they walk all over you. Strong boundaries, but seeking to understand, and they're not going to necessarily argue with you if you're humble with them. You have a vision of what it's going to look like having a daughter one day, and then it looks different. It's not bad, it's just different. And she, I feel like she needed me so much more. I would feel so much guilt going to work, taking care of other people's families, and coming home and feeling like I can't help my daughter.
Minnie Ansby, welcome to the Device Girls.
Thank you. Thank you for having me. We're LA to Texas. This is awesome.
Yes, we're so excited to learn more about your journey and your experience as a nurse. And Mindy actually also has her own podcast called Call the Nurse. And so please go check that out. She is putting out some amazing content. And Mindy is based out of LA, correct?
LA, yeah. Arkansas
LA.
girl all
Okay.
the way to LA now, right?
Oh my
Oh,
gosh, that's
wow.
amazing. Can you
Yeah.
just talk a little bit about and introduce yourself, talk a little bit about your background?
Sure. Yeah. I'm Mindy and Tebby. I moved from my little small town of Manila, Arkansas, 25 years ago to come to Los Angeles, thinking I was going to be famous doing something, but I became a nurse. And that has been a great journey. I've been a nurse for over 16 years in the ICU and PCU. And over the last 25 years, had a daughter. She's 19. I have two stepchildren, 21 and 22. Both are studying the MCAT right now, getting ready to apply for medical school. And I have an incredible husband, Dr. Alana and Tebby, out here in LA, who is an orthopedic trauma surgeon. So we live a very kind of hectic, chaotic life.
Yeah.
But I started a podcast called Call the Nurse because, as you guys know, on the floor, when a patient needs something, they're not calling the doctors, they're calling the nurse. And I started just seeing all these stories of people in the bed and sick, and they all have their lives behind the scenes. They're all going through something. And I was going through my own personal journey with my daughter, who has autism, high functioning autism, and she started struggling with her mental health and, blending a family and divorce, co parenting, all the things. And I thought, I just want to talk to real people, real life, who are going through their own code blues outside of the hospital, their own code reds, their own
Mhm.
journeys, that the stories that don't really make it in the chart. So that's how I came up with my podcast, just talking to real people going through their own crisis, their own inspiring stories. I'm going through this 47-year-old midlife thing, reinventing myself. So just trying to inspire people along the way and have great conversations.
Oh, I
I
love
love that.
that. That's amazing.
You.
So talk a little bit about like what drew you, like how did you first know you wanted to get into healthcare in general and become a nurse?
Yeah, I grew up, like I said, in a really small town, and I had the dream of going to medical school. I was pre med with full scholarship, graduated with 39 people in my class.
Wow.
I tell my husband I was the top 10%. He's like, yeah, that was like three people.
Hey, you
He's
know
like,
what?
of
A
course. He's
win,
like, there wasn't much competition. I'm like, okay, whatever.
a win is a win. A win is
Exactly.
a win.
Right, absolutely. In my little town, I was something. And, I just started probably watching MTV way too much and just thought, I want to go to LA. I want to leave this little town. I love the people there, but I really just started feeling this draw to LA. And once I got here, it is expensive to live here. I was 21. I didn't know anyone. And I realized, yeah, college right now is going to have to take a back seat. And, eventually, strangely, I actually, about a year or two after moving to LA, I went into the full time ministry, which a lot of people don't know. With my church, that, yeah, Christian church I was a part of, I led a campus ministry for 7 or 8 years, and then eventually married my husband, was doing the same thing. And we had our daughter. And 10 years in, I started, wanting to do nursing because I had a baby, and I started nursing school when she was 6 months old because medical school at that time, I wanted to help people, right? I think we have a heart to where we want to help people. So I went into the ministry, which was a great, I think, foundation for being a nurse with people. But we went through a lot, ended up going through a divorce, and going through a divorce when you're in the ministry is interesting, and you go through a lot, especially with a congregation. I've just learned a lot about myself, my faith, and we eventually divorced, but we became the best of friends. We're still very, very close. My ex-husband, he in fact just stayed here while I was out of town with my husband and my daughter, being just kind of a team trying to get my daughter here and there, and while my husband's out working. So I became a nurse while that was going on, and thank God I did. You know, I went through a divorce and was on my own, and had my nursing career, and I'm kind of glad I didn't become a doctor. I just don't think I would have done well in that environment. So it was a perfect blend of this nurturing plus ministry. It just kind of came together as a nurse. So that's what
I
I,
love that.
enjoy doing.
Yes. So what specialty did you end up finding yourself into once you stepped into nursing?
You know what? I think every nurse thinks, "Oh, I'm going to go into labor and delivery, or I'm going to go into, something like that." I heard women screaming, and I'm like, "No, no, I'm not doing this." I landed my first job as an ICU nurse right out of nursing school, and then I've been doing that since I graduated in 2009. I like whatever I'm doing. I want to do it like the best. And kudos to the med surg nurses. I think they're awesome. We need them, but I wouldn't be able to do with 5 patients not on a monitor. That would be very difficult for me. So I love the critical care. You get to follow their journey. You're with them really from the beginning, and you get to see the progress. Not like an ER to where you patch them up and send them to us. So that has drawn me, and I feel like you really bond with families, and that is what I really love about the ICU and intensive care. I'm primarily now on PCU, like a step down, and I typically am a resource nurse now, and just helping the nurses and the patients mostly. But I still love taking patients, and I'm still there. I was there yesterday. 12 hours. I flew in, slept for about 3 or 4 hours, and went in for about 12 hours last night. And here I am.
Oh my gosh. So do you primarily work nights right now?
No, no, I do work days. It felt like
Okay.
nighttime.
Okay.
I did get in at like
Okay.
4 in the morning, slept for a
Oh,
few
okay.
hours, went in, and I got home around 8:30 last night. So I'm still 12 hours. I was there a little bit later last night. My husband was there. I hadn't seen him since I got back. Because I was filming a podcast in Florida, and I saw him, in the hallway bringing me snacks. So we got to see
That's
each other at the
amazing.
hospital. So no, I worked nights 5 years, and just realized it worked well, I think, when my daughter was young, but as she got older, I really wanted to be somewhat coherent during the day. And so I've been doing the day shift about 10 years now.
Okay. Wonderful. What is something for you that has kind of changed your perspective in nursing that you've experienced on the critical care floor?
I think I think with critical care, I think just in life in general, I just critical care, just you're dealing with family dynamics, right? I think in so many other areas of nursing, you're not necessarily so involved with family. When you're dealing with a family for a month, you're involved. You know who mom and dad is, you know who brother is, you are really, really in there. And I think with nursing in general, it's really hard. It's hard not to harden your heart because you do get so attached. It's hard to not get too involved to where there's kind of an immersion, and you're going through your own things at home. But I think in being in ICU and critical care, it just changes your perspective about life in general. We're dealing with a lot of life and death situations. We're dealing with watching a young mom have a baby and being there 1 minute, not there the next. You're not necessarily dealing with that on the floors, hopefully not. I think it just, you have an appreciation for what nurses go through in the life and death. I had a professor when I first became a nurse saying, it is a privilege to watch life come into this world when we're delivering babies, but it's even more of a privilege to be with someone when they're leaving this life and passing on. And I think that has always stuck with me. That has always made me feel I will never let a patient die alone. If it is up to me, I will go in, I will do everything in my power to make sure that they know that there's a voice there, because I think that is so important, just the humanity of it, and not just room 1301 is DNR, they're passing away, their comfort care. It's changed my perspective on how I deal with not only people in the hospital, but outside of the hospital as well.
I love that. That's something we've been talking about a lot lately, like just along with like our mission with the podcast is to like we're trying to humanize like medicine in these conversations because I feel like it a lot of it is they don't really coincide right now. And so like bridging that gap. But you brought up an interesting point, and since you love talking about this with other people, you said how, you try not to harden yourself like working in the critical care. So what are some things that like you do as a nurse to like keep your heart soft and like stay completely engaged with your patients even though, these are situations you've been through before?
Yeah. I think when you go through your own personal journeys, like I said, I went through a divorce. I was a part of, a church, or I was a part of different groups of people. When you go through your own tragedies and you don't feel supported or loved during some really bad times, and maybe you're not making the best decisions, right? I mean, how many people do we come in and have alcoholics, and it's very easy just to be like, oh my gosh, you have these kids, but you don't know their story. You don't know what they're going on behind closed doors. And I just feel we don't, when I go through my own thing with my daughter, no one knew at the hospital that I was having to send my daughter off to a therapeutic boarding school because of some mental health issues and some issues with going on with her autism. The mental anguish I was going through at home, I thought, if I was in a hospital bed right now and no one is really understanding me or understanding what I'm going through, because I think a lot of times it's hard for me to push medications. And I think to myself, man, if we could only fix that little girl inside of you, right? Like, it can become a chronic illness just because of your heart sick. So I really feel like that has helped me remain grounded and always see people. I just recently did a podcast with a woman who I took care of her brother about 8 years ago, and he has cerebral palsy, quadriplegia. I mean, he doesn't speak. He is really contracted, but she would tell me, like, he's in there. Like, I can see, I know he's in there. He's 50. At this point, he was like 50 years old. And we can really dismiss those cases sometimes, right? They're not talking. You think the family's a little bit in denial of, like, are they really cognitively there? I had to listen to her. She knew him way more than I did. And so I think when I go through my own situations, divorce, remarriage, dealing with blended families, dealing with the mental health of my daughter, wanting people so much to hear me and understand me, I want to do that for my patients. That helps me keep it human, not just a chart number. And people even tell me at the hospital, maybe you're just getting too personal. I said, the day I stop getting too personal is the day I probably don't need to do this anymore. I'm not going home with them, right? I'm not, but there are a few you do get bonded to. And I think once you lose that as a nurse or anybody in the medical professional or as a medical professional, I think it gets a little sketchy. There's always a brown boundary, but my my dedication to my family. I have a women's group that's a Warrior Women group and Wise Women that we get together once a week and we just talk about empowerment. That's how I started this podcast. That's how that was birthed as well. Keeping yourself grounded with other relationships. I mean, you've got to, right? When we come home and we deal, how do I have dinner and I just saw a woman on top of her husband screaming because he just lied, and then I'm like, okay, do we having steak tonight? Are we, what are we doing? That can like really get you. So I think you got to have support on the outside. And you guys see this too. I'm sure you guys have your own ways of coping, staying, healthy. I mean, I do like to indulge. I love my Southern food. So,
Yeah.
I do that as well.
Yes.
So those are just a few
Absolutely.
things.
Yeah. What
Absolutely.
has that journey, and if you're comfortable, like
Sure.
with, your journey with your daughter, how has that also kind of helped shape how you've shown up as a nurse?
You know, when you have a child who you have a vision of what it's going to look like having a daughter one day. and then it looks different. It's not bad, it's just different. And she I feel like she needed me so much more. I would feel so much guilt going to work, taking care of other people's families, and coming home and feeling like I can't help my daughter. When you have high functioning autism on the outside, it looks like you're fine. She's this beautiful, intelligent girl. But junior high, high school, the girls aren't so nice, right? And mental health challenges, social media, there's so many things going into it. And I started feeling like, how do I take care of all these other people when I really need to focus on my daughter? So now when I do that, you have a patient, you have their family. I always pay attention to what's going on in a room. Is this mom? Is this dad? Is this your son? Show me tell me about them. People feel listened to. I'm kind of known for sitting on patients' beds. People are like, oh my God, that's so gross. I don't like standing over patients. I learned my daughter doesn't like when I come in a room and stand over her bed and talk to her. It's like, you know, that's that Southern mom in me too, of like, clean up your britches off the floor and do this and do that. Right? I'm
Yeah.
kind of that
Yeah.
old fashioned. And I feel like what I've learned with her, I've really learned how to deal with my patients sitting on her bed and, okay, honey, what is going on? Let's talk about it. When I see a patient cry, I sit on their bed. Okay, tell me what's going on. Why are you calling everybody, cussing them out? It really helped me see people and what was going on, like behind the eyes, like in the heart, rather than giving meds, doing what you need to do, your daily task, which is very easy for a nurse to do, especially in critical care. You're trying to get things done. It just helped me slow down, get to know them.
I
I
love
love
that. Oh my goodness. So talk a little bit about your relationship with Dr. Entebbe and how you guys met and kind of the dynamic of getting to have a physician nurse duo household.
Yes, everybody is like, is it Grey's Anatomy? No, it's not Grey's
Is it Grey's
Anatomy.
Anatomy? No.
I value my job way too much for it to be Grey's Anatomy. It's
Yeah.
really interesting as we look at it now. I recently just interviewed my stepchildren on my
Okay.
Okay.
podcast.
Okay.
I interviewed my stepson separately. He's 20, just turned 21 at UC Boulder, and my stepdaughter is 22. She just graduated at LMU, and incredible, incredible kids. But I met them when they were 12 and 13, and I got their perspectives of what it was like. Because who talks about this really? What was it like having another woman kind of come into your life? And what was it like watching both parents move on and going through divorce? I met my husband. First of all, I said I would never marry somebody in the hospital. Tell God your plans and let him laugh at you, because I've done everything
Yes.
opposite
Yeah.
of what I said I was going to say. Going to do. This surgeon was on the floor. I'd heard of him, didn't know him. He handed me his card, and I'm thinking, why is this orthopedic surgeon? Maybe I walk funny? Maybe my knee looks funky? And he just wrote a little note. I'm like, why is this? What does he need? Why do I need this guy's card? He was very handsome,
Uh-huh.
and he. I had heard, oh, he's married, and I'm like, okay. Then it bothered me. Then I thought, why did he think it was okay to give me his card? Because you hear about
Yes.
doctors and nurses and whatever, and I was not going to kind of go into that. And he left his number, and I said, because he wrote, do you have a boyfriend or a husband? And I said, I think the more appropriate question is, do you have a wife? And I think he was like, oh, we're separated. We'd been separated. And I was like, listen, um, good luck. The grass is not greener. You've got children. Here I am preaching to him, and he barely knows me. He's like, oh my God. And from there, it's funny. He just started asking me questions about my divorce. My divorce was overall amicable. We're still very good friends, and we really became friends, talking through his divorce and how does he maintain, a friendship. That divorce lasted like 3 years, and I said I wasn't going to date him until it was official, everything. But then his ex-wife moved on. I mean, we all laugh about it now, because
Mm-hmm.
we all said we weren't going to do certain things. The divorce lasted forever. When there's a little bit of money involved, it just kind of gets a little ugly. And I kind of became a friend to both of them. I kind of would talk to her on like, hey, let's talk about this. They would text and I'm like, guys, let's, talk. I did he wanted me to meet his kids after seeing each other. I didn't want people in the hospital knowing for almost a year. My daughter did not meet him for a year because I didn't want to introduce her to somebody that I told my ex-husband, I'm like, "I'm kind of seeing a doctor, but it has an expiration date. Like I'm not gonna, this isn't gonna go into marriage or anything." Here we are 10 years later. And he had wanted me to meet his kids after about a year. And I said, I will when I meet your ex-wife. And he's like, "Why do you have to meet her?" I said, "Because as a mom, I just feel it's just respectful. If my ex introduced my daughter to somebody without me knowing, I just would have a hard time." And I texted her and I just said, this is before we all became, close, and just said, "Hey, do you mind if I sit down with you?" And I think that really set a foundation for our relationship and for mine and her relationship as eventually a stepmom. And she's like, "My kids are going to love you. Thank you so much for sitting down with me." It's not been always great and pretty the last 10 years, but I will say I think that set a foundation, and it set a foundation for the relationship with my stepkids. And then my husband is like, "Okay, you're right. That was helpful." So that's how we don't neither of us wanted to get married again. I think going through a divorce, you don't want to go through that again. But I think after 8 years together, I had a teenage daughter still in the house. I just felt like I want to do things, right. And he's Jewish, so there's a whole dynamic there. And we got married 2.5 years ago, so we've only been married 2.5 years, but together 10.
Oh,
Oh,
And
wow.
fun.
yeah, we both did it when it just was the right time, and I'm really grateful we waited. But it's fun. It's crazy. It's a crazy life, but we get each other.
That's awesome.
Right?
So,
Like
Yeah.
this
yeah.
morning, 4 a.m., I'm
Yeah.
texting, like, "Where are you?" And he had an open fracture. And of course, I'm like, "Send me pictures. Don't send names. No HIPAA violation." Like, I want to know because I'm fascinated with what he does. Like, I think he is like, it's crazy the things he puts together. So we just get each other. We get the schedule. I may see him, I may not. It just really works.
Yeah.
Yeah.
And you
So,
definitely
yeah.
you have to have somebody who understands that and who can just show up with grace and like continue to be thankful for the work that you're doing for patients and I mean just not have animosity towards that at all.
Yeah, because listen, he's gone a lot,
Yeah.
right? Like about 3 or 4 years ago, he started taking a week off a month. And a lot of that was really to get time with kids because he's on call 10 to 12 days a month. He has a private practice that he has multi specialty now. He has his own surgery center. He's orthopedic director at 2, 3 hospitals.
Oh my
He's
gosh.
gone a lot. He's known as the yes
Yeah.
man around here and as trauma and elective cases. So you got to have somebody who's somewhat understanding of he's not going to be around all the time. So I mean, I like it. I don't have to cook when he's not here. I can watch my 90-day fiance and not be judged. I can order pizza, I can do whatever. And then when we know we have that week off, it's phones off, it's connecting, it's with kids, it's with us, and that is how I really feel like we've been able to make it work. Even his staff is like, "Oh my god, he's a different human being," because he's able to really disconnect when he has that week off. I think that has really helped.
That's
That's
amazing.
awesome. So, what was that kind of like after you guys announced that you were
Came
together,
out,
or people started, yeah, or people started
came out of the
figuring
closet,
out?
came out of the med closet.
Yeah, and
The
like
med
what's it
closet.
been like working together in the same place as well if you're there at the same time?
Yeah, in the beginning, it's listen, he's a really intense guy. The nurses love him. Um, it, I struggled really because I didn't want to be considered like, oh gosh, another nurse, doctor. Rumors are in the hospital, right? Like, and then if you're going through a divorce, it just gets sticky, and I didn't really want any of that. But in the beginning, it was like, oh my gosh, you guys are cute together, and we have a lot of fun. And I remember even putting our first like Facebook post out. It was kind of like, oh my god, and people were like,
Yeah.
Daunting.
what, Doctor and Tebby?
Uh-huh.
Um, it's interesting because they knew him a certain way. He was like, he's a little rough around the edges. He's a bit intimidating, really intense
Most
guy.
ortho surgeons are.
Yeah.
Let's be real. I think
Right?
if there's one surgeon, well, I guess two, it would be neuro and ortho.
Oh, yeah.
Those two, you're like,
100%.
oh, okay, do I
Yes.
really have to?
Yes.
Yeah.
Yes. It's like the whole ortho bros, right? He's like
Oh, yeah.
the epitome. And people were really afraid of him. I mean, there were nurses that would say, "Oh, I get really scared. I like peed my pants one time going in the OR," but that bothered me. Right? He's terrifying, but
Yeah.
it bothered me because I thought, because here I am a nurse, or I would hear the way he spoke to a nurse in the middle of the night, and I was like, "Oh, no, 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 no." Like, no, that she is doing what she needs to do. She doesn't know you. She doesn't know she shouldn't call an orthopedic surgeon at 2 a.m. for a blood sugar. Let's give her some grace.
Yeah.
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 But you still got to respect people. So in the beginning, it was like people were interested in like, wow, how, because he's kind of a jerk. And now they're even saying how it's funny how it was this rocker music in the beginning in the OR, and now they're like, he's playing Coldplay. Like, what's going on with him? Or he's
Oh my
softened.
gosh. Yeah.
And I
Yeah.
do think he can be just as intense, but there is a softening. And I think I've helped him look at people and patients with a different light as well, especially with him going through what we've gone through, even with my daughter and just divorce. Now it's like you guys are perfect together, and you've brought such a different side of him out that we didn't see. He's helped me be more serious and a little bit more business minded, and helps me kind of be disciplined. But now it seems like it just was always supposed to be. Everybody just thinks, I mean, I literally post, I don't know if you guys are seeing this caricature thing that everybody's doing online right now, where they're
Yeah.
doing this cartoon.
Oh,
And it's
yes.
something you put it right. Have you seen that?
Yes.
Yes.
We did it, and it's hilarious. It's hilarious to see what his phone put out and what mine did. And he posted one of them, and this nurse was just so offended, like, maybe because I had a nursing outfit on, I was thin, I don't know. And she's like, I'm an ICU nurse, and it's offensive. And I was like, honey, I'm an ICU nurse. We gotta laugh, right? We gotta laugh. And I don't feel unintelligent. It's hilarious. There's a stigma of you guys are this cute couple, and if people that know us thought it was funny. And I just think, come on, guys, it's a picture my phone came up with. So now it's just a fun joke. It's at work that we're just this cute couple, and we both love people, and we both love serving people.
Yeah. I love
That's
that
awesome.
though, like to kind of hear a little bit about the dynamic of, I mean, because I feel like you definitely played a role in that, in the softening of
Yeah.
his heart. I mean, I'm not sure. So was his prior relationship with a nurse as well, or were you the first nurse that he had?
His ex-wife, who is an incredible woman, incredible mom, she's a doctor. She's an optometrist. She's a doctor. So that was a bit also intimidating, right? Because I'm now going into social circles with all doctors. I was really the only person he ever introduced to his kids or his family, and here I am, a nurse. And so there was a bit, I'll be honest, there was insecurity of like, oh, she's a nurse, or oh, she's just a nurse, right? Because I'm always around his colleagues now that are all doctors. And listen, you're now in friend groups where the wives, and it was, yeah, it was a bit intimidating. But I really, once people got to know me, and once she sat down with me and she knew who I wasn't just this nurse having a fling with, her ex at work.
Right.
That's all that mattered to me,
Yeah.
was her opinion.
I
Once
think it's
once she
important.
was okay, I was fine.
Yeah.
Yeah.
And I think it's important I mean, that for one, that takes courage and boldness to put yourself into those situations and push through feeling that insecurity. And it's hard, but I mean, like overcoming that. And I think it allows people in different social circles to also, I don't love the stigma of, well, they're just a nurse. Like, what does that
I
mean?
know.
Because they do so much, like everyone in healthcare in their roles does so much. And I think when we're approaching it as pitting it against each other, or like, well, I'm here and they're there. I mean, let's work together as a team, because collectively our whole goal is to help heal
Right.
patients and care for patients and transform
Right.
lives. Right.
Well,
Well,
you guys
to
the same way, right? I mean, the reps.
Mhm.
I mean, listen, there's a
Oh
stigma
yeah.
with,
We wear
the
red
orthopedic
bonnets on our
surgeon,
head
right?
to
Or
stand out like
the orthopedic surgeons with the rep. I mean, there's just all these.
oh yeah.
I just think it's what I kind of love about us too is that we're we're able to kind of set an example. And again, we are not perfect, and we have not been, and we have learned so much. But to be an example of a nurse doctor kind of duo that we love our patients. When he rounds on patients, sometimes I'll go with him just to kind of get to know his patients and help him kind of, interact. He thinks he's not a great communicator. He's gotten so much better. But you're right, there is this kind of stigma. I don't think people really know what nurses really do. I don't think people really know what you guys really do sometimes. I think it's great that we're able to talk about it because there should be such a respect. I do think it's the level of education and discipline because my husband will say, I when I got married, I thought I'm going to meet this woman in medical school. She has a great family. I love her parents, like his ex's
Mhm.
parents are like
mm,
I'm closer to them than I am my husband's parents. Like I love them so much. You can just tell what they've poured into her, what they've poured into their grandchildren. So I do think there is a level of respect and discipline that comes with going to medical school. And my husband was like, I just thought all of it's going to work out perfectly because good family, you know, discipline, you go to medical school, it still may not work out with the best family, the best education, and that's okay. And now he's with a nurse, and that's okay too, because she's smart and she's fun and we have a great life together. It doesn't mean because I didn't continue on. He did say when we first met one time, wow, you were going to go to medical school and you just went to nursing school? I was like, oh, oh, um,
struck a
yeah.
nerve.
Right? But then when he heard this story, what I keep saying, when you hear the story behind it, I moved to LA, I got married, I was in the ministry, I had a child, I then you're like, wow. And now he's been able to see what I do. He watches me with my patients. He watches me when he comes on the floor and he watches how I talk to them. Now he understands. He sees the woman behind. He sees me cry in the middle of the night because I can't help my daughter and I get up at 6 a.m. and I go give to my patients the next morning. That changed his perspective.
Well, that's one thing I was gonna say that I love that you brought up is that I think at times it's important for us to like realize too that like whether you're a doctor or a nurse, like sometimes we only understand, or as reps, we only understand what it feels like to be in our roles.
Mhm.
And so, like, I think it's really cool that he's able to gather a different perspective. And I'm sure, like you said, he does now treat his nurses with a different, I don't want to say a different level of respect, but just
A different
like
appreciation.
a different appreciation,
Yeah.
which
Yes,
I
Which I
think
guarantee
it's,
you his whole staff is also like, "Thank you so much,
yeah.
Mindy."
they are all the time.
Another thing like we're trying to do is like, and you as well, is like help humanize it again. Like we're all
Mhm.
just human at the end of the day. And maybe if we had different perspectives and we knew where people were coming from and their roles, we
Mhm.
would have a different care and respect for them.
Mhm.
Right. Yeah, I mean, look at the nurse who calls in the middle of the night to a doctor. They're terrified. They don't want to
Oh,
call
yeah.
you.
Oh yeah.
So you making them feel worse than what they already do. First of all, it's not going to help them feel confident. It's not going to help them want to advocate for the patient next time because they're afraid of what the surgeon's going to do. It's just a different perspective. Some of these are new grads if they're calling at 3 a.m. for random things. So keep that in your mind, babe. When you're agitated that you're not getting sleep, they don't know. All they see is the wound vac is not working and the patient's bleeding, and they just want the surgeon to know. And she's peeing her pants calling you. So it's different than saying, okay, what do you want? Not to say that he does that, or at least
Right,
doesn't
right,
Yeah.
anymore.
right.
Or in saying, yes, yes, what do what do you need? Let's call this, let's call that. That makes them feel more confident and it makes them feel confident to advocate for that patient next time. Like, don't make it harder than it already is. And doctors don't always listen. I've been in the OR with him with these reps that I'm like, you guys can, like, you can see x-rays. You're not even going to medical school or even nursing school, and you guys know more than the nurses a lot of the times. Like, that's like fascinating to me, but I wouldn't know that had I not been in the OR with him. I would have no clue.
Yeah, it's true. I think like that's probably been one of our favorite things, and I'm sure. I mean, just your dynamic of your relationship and marriage, and getting to see different sides of the healthcare space as well. That's been something we've loved in our roles, but also doing this podcast is
Yeah.
learning so much about cardiovascular perfusionists. What do they
Yeah.
do? I mean,
Yeah.
like just on all of these different specialties and roles, and having such a deeper appreciation for um how we all have our own little like role in healthcare to change a patient's
Mhm.
lives, and they're
Right.
all so important, and truly without each other we can't do this alone,
You can't. And you're bringing your own set of experience in your own life.
Mhm.
I just had a guy on, Dr. Donald Wiss, an incredible man. My husband introduced me to him. He kind of wrote the book on fractures. He's an incredible orthopedic surgeon. And I
Oh.
had him on because he wrote a book about his wife who her PhD in psychology, got early onset dementia,
Oh,
Oh,
retired
wow.
wow.
early, and had everything planned out, right?
Mhm.
They saved, they were going about to travel, and now he visits her, had retired early to take care of her, and then
Mhm.
now had to put her in a facility.
Mm.
At that time he was still working. Do you
Mhm.
think that the random patient knew that he's taking care of his wife
Yeah.
at home? He just it just gave him a different perspective on people. And
Yeah.
then
Mhm.
now he goes every day to walk with her. She doesn't necessarily know exactly who
Oh.
he is. He gets her nails done every 4 weeks. He gets her hair done every 6 weeks. And
Oh.
I asked him, I said, is this your greatest role as a caregiver? I mean, 30, 40 years of an orthopedic surgeon. And that's like the greatest joy of his life now, although very painful.
Yeah.
So we all come to the table with a story that we have at home. We're
Mhm.
all going to go through something. So it's not even just all of our roles, handing tools or me
Mhm.
pushing meds with a patient. Like, I don't know what that patient's going through when she's sitting in a bed, pounding the call light and yelling at the nurses instead of getting frustrated, just going and going, babe, what's going on?
Mhm.
Mhm.
Let's talk. And I had a girl say, I lost my kids because I keep drinking. I mean, you're
Mhm.
sitting in a bed and you're vulnerable and you don't have control. And then
Mhm.
someone sits on your bed and says, what's going on? What are we feeling? Like,
Mhm.
that's a whole other level of care. And I think
Mhm.
I was only, I think, able to do that because of my own experiences, what I'm bringing to the table.
Mhm.
Absolutely.
You got to learn how your husband approached medicine and his mindset, which was a little bit different than yours. Like it's, a little bit
Yeah.
just stronger, blunt to the point. What maybe did you find that helped allow you to understand him better in his approach?
That's a great question, actually, because sometimes I can get frustrated at him with maybe his delivery or him
Mhm.
Mhm.
being so callous sometimes, I feel. And yet when I stop, and yes, I've been with him in the OR before, although we don't necessarily work completely directly. He will come to the units. Yesterday he had 3 or 4 patients. He specializes also in pelvises and acetabulums. Not every
Mhm.
orthopedic
Mhm.
surgeon does that. So they'll transfer from other hospitals to come to him. So he'll be on my unit here and there. And when I see what he does in putting a pelvis back together, when I see that he's able to walk or help a patient walk again that they'd never
Mhm.
thought they were going to walk again, and then I see the stress at home of he takes care of his parents, he takes care of his kids, he's got multiple other businesses, he does real estate, he does this, he does that. I can see where someone would kind of have to, in a way,
Mhm.
harden a little bit. He tells me sometimes, I have 20,000 things running through my
Mhm.
mind,
Mhm.
that the stresses that I have I try not to put on, my family.
Mhm.
So when he goes into a patient room and he's dealing with this situation, I mean, orthopedic surgery is crazy. I mean, you're
Mhm.
literally putting people back together and not even knowing sometimes. I'm like, how are you going to put that bone back together? I don't know. I have an idea, but you never know when you're getting in there. I'll MacGyver the
Yeah.
situation, I'll figure it out. That's a lot on someone's
Yeah.
mind. And I think that's helped
Absolutely.
me understand him.
Mhm.
Yesterday he had a long day, I'd had a long day, and I started telling him about some other stuff that was going on, and I saw it in his eyes, and I'm like, this isn't the time, is it? He's
Yeah.
like, babe, I need to I need to
Yeah.
chill. Like
Yeah.
Wednesdays are his clinic days, and he'll see sometimes 100 to 120 patients. I know that's
Wow.
insane and crazy,
Oh my
but
gosh.
listen, it's some of it's follow up, some of it's,
Yeah.
he has a scribe, he's quick, he's does different, obviously consultations are longer and different things.
Mhm.
And he'll tell me Wednesdays, that's not the time to have a deep talk with me when I come home. He's
Yeah.
talked out.
Yeah,
Not to
Yeah.
mention
yeah.
he's not never necessarily wanting to have deep talks anyway.
Yeah.
So I think in the medical field in general, we have to kind of look at each other of like, what did they go through that day?
Yeah.
Right.
I have to have a lot of grace. And I think
Mhm.
he has to also with me, but watching what he does and who he takes care of and the stresses just as a man and an orthopedic surgeon and a dad and a husband
Mhm.
and a son, that has really helped me see him and be much more gracious. I've
Yeah.
gotten better. I'm not always perfect at it, but I'm getting there.
Yeah.
I
Love
actually
that.
love that too. Like, yes, your perspective is great, like coming from being his wife, but I think people who go into doctors' offices as patients are so quick to judge
Mhm.
their doctors,
Absolutely.
nurses, the staff all the time so quickly. And it's like, oh, he barely spent any time with me. Well, you also don't know how many patients this doctor is seeing today. What else is going on? Maybe they just came from the hospital and their patient just died on the table. And so, like,
Absolutely.
I think that brings up such a great point again, like on perspective of like, you really truly never know what someone else is
Mhm.
going through. And like, I grew up around some orthopedic surgeons and they're very
Mhm.
much like business minded. They have other things
Yeah.
going on,
They're a
family
different
things,
breed.
kids.
They
And
are
it's
a
like,
different breed.
100%.
yeah, I can understand where someone wouldn't be so like, okay, today we're no, because they're in their
That's
head
Yeah.
all the
not what
time,
they're
you know?
doing. Yeah. And I think when you're seeing that many patients in, they'll be like, oh my God, I had to wait 2 hours in the office. My husband kind of approaches things a little differently. If you want to see him tomorrow in his clinic or Wednesday, he'll be like, okay, I'm not going to make you wait 2 months,
It's awesome.
but
Yeah.
come in at 8 a.m. You may have to
Hmm.
wait a couple hours because I'm squeezing you in. So it's kind of one of those things of, do you want to come in and see him now and
Mhm.
potentially wait a while, or do you want to wait too much, which is what a lot of other people do, which is fine,
Mhm.
because if they feel they can't really give the care they need, you need to really space out and only have 50 patients in a day, that's fine.
Hmm.
And most people in a lobby aren't thinking about, wait, he squeezed me in today, or wait, he squeezed that person in today, right?
Right.
So yeah, you don't
Mhm.
really understand what what he's doing or how he's trying
Mhm.
to see all his patients, meet all of their needs, because we want things now.
Mhm.
We want you to talk to us. And his staff will sometimes say, can you text him and tell him to stop having tea with the patient in room 6 because he's chatting too long, and I'm like, if he's having tea with somebody, that means there's a reason.
Yes.
Yeah.
Yeah.
Aw.
I think that's I really think like that helped me just speak for myself in my role too when I really started to learn that and really implement that in how I approach surgeons is that I'm my first and foremost, I want to really learn their love language. I want to
Oh
learn
yeah,
like, if
that's
this
a big
is
one in our house.
yes, like is this a surgeon who like I have a couple surgeons who are like, "Hey, I don't really have the time or want to. I'm too busy. Don't like ask me to go to lunch." Just like if you text me and say, "Hey, can you meet me in
Absolutely.
20 minutes in the physician's lounge for some coffee?" Sure, let's like get right to it. I have some that are like, "Please take me to lunch. Please take me to dinner." I have some who are like, even though I'm their rep, I mean, because I'm in the robotic
Yep.
space, so it's not like orthopedics where the rep's normally present in every single case. And so I have one surgeon, like the nicest guy, but you would not know he's the nicest guy if you dare to talk to him or walk into his OR. I don't go in there
Absolutely.
unless something's wrong with the technology and I get a call like, "Hey, can you come help troubleshoot that?" It's like, "Absolutely. I'll stay for 5 minutes, fly on the wall. I'm not gonna say anything, make sure everything's running smoothly, and I'm out."
Right.
But if I text
Right.
him on his clinic day, he's like, "Yeah, come see me." And so
Right.
just like learning their love languages and then how to appreciate the dynamic of what all is really going behind the scenes
Yeah.
here to show up
Yeah.
and show
What
up with
what place are
grace.
they spinning? But isn't that marriage? I mean, isn't
Yes.
that friendship?
Mhm.
Yes. Yeah.
Right? I mean, and I think
Absolutely.
that's the whole thing that I really, when I talk about how I want to talk about the stories that don't make it in the chart. Everything we do, whether it be you, like you're just saying, with how you interact with a surgeon, or how you interact with a patient, or how I interact with him. I know on Wednesdays it's not the day
Mhm.
to. First of all, his love language is not words of affirmation. That is not something he struggles with. That is not
Yeah.
that. Now, if I take the trash out and I clean the pool, he thinks I am like, he can't even believe it.
Uh,
But if I'm telling him and doting over him, he gets that every day.
Yeah.
uh-huh.
He doesn't need that. And even
Yeah.
recently, you got people that are suing doctors every day right now.
Mhm.
And he just recently had to go through something, and he's coming home, and you have all these nurses calling and doctors calling, and I legit had a complaint about something, and I thought, mm, not today. I mean,
Yeah.
Mhm.
I really wanted to. Like,
Yeah.
Yeah.
every part of me really wanted to,
Yeah.
but I thought today's not the day, or if his kids was like, hey, I called my dad and he didn't even call me back. Hey,
Yeah.
FYI, this is what's happening. It helps
Yeah.
give you a perspective. Or even his ex-wife, like, he hasn't texted back and blah, blah, blah. Hey, let's have some patience with him right now, because man,
Mhm.
and it just helps, but that's relationships. It happens
Mhm.
that's why we're in the medical field. Not everybody
Yeah.
Right.
can analyze a room and kind of what's their love language, or what makes them tick, what doesn't make them tick. That's
Mhm.
why there's attorneys, that's why there's other people in the world. We do this
Mhm.
because we're able to kind of have that emotional maturity. I shouldn't say
Yeah.
maturity, that kind of
Intelligence.
emotional
Yeah.
barometer intelligence in that way, because we're
Yeah.
able to do that and make it good. But I think we have to do that in everything that we do.
Absolutely.
Absolutely. So, do you have like maybe one specific patient for you that like really stuck out or really like inspired you and made you want to like start the Call Her Nurse podcast? Because you're talking about how, it's like things that don't make it onto the chart. So was there something that really sparked that in you, or was it just over time?
Yeah.
I think it was accumulation of things. I do think being in my group with the women that I'm a part of, figuring out like I'm a good speaker, or you seem to really connect with people, and I thought, oh, what can I do with that? I will say there was one right before I started the podcast, and again, this is on top of everything I dealt with. My daughter being gone for 2 years, she just came home this summer and she's doing great. That was a very hard decision to send your daughter away. A lot of judgment, a lot of, here I am a nurse and you hear horror stories about Utah. Like, there was just so much I was going through and wanting people to see me and know that, hey, I have a story too, and I'm still coming to work and showing up and giving you my all. But there was a woman that I remember, she was like 39, alcoholic. She just had a baby not too long ago. And I could just tell, she's going through withdrawal, a lot of shakes, bright yellow, right? Jaundice, cirrhosis, sitting on the edge of her bed and crying because she couldn't feed herself because she's shaking so bad. And happened to notice as I walked by, because I was a resource, and I sat on her bed and I just kind of took her fork, and she starts just sobbing again. And I said, it's okay. Like, she's like, I shouldn't be doing this. I'm so ashamed. Here I am. I can't even feed myself. I have a baby at home. And I said, it's okay. Like, let this be the time someone takes care of you. Well, you're going to get there, right? You're going to get stronger. You're going to get through this, and you got to get sober. Think of that. So I kind of was talking to her, and it made me emotional because, again, she wasn't a patient anymore. She was a woman who is like grieving and feeling so much shame and guilt. So if it like would have gone in and been like, oh my gosh, you're making a mess, and what do you need? It would have made it worse. And she died, coded and died the next day. Like coded and died the next day. I literally have chills talking about it. And I remember going back and trying to go to her room, and they're like, "Oh, she coded and died." And I'm like, "I'm sorry, what?" Like I just sat on her bed yesterday, like yesterday, and all I could think about, oh my God, this baby, oh my God, this baby, and oh my God, she was so terrified to die, and she was so afraid of leaving her daughter, and felt so much shame and guilt, thinking, oh my God, what was she thinking at the last moment? It's like thinking of everything. And the people telling me are like, oh, she was like an alcoholic and she was a mess. She had esophageal varices, she bled out, and yeah, she died. I mean, how sad is that? But I sat on her bed with her. I knew her story. I knew she had a newborn. I knew that she already felt so much shame and guilt. That I just felt like we don't see that. We don't take the time. And granted, nurses don't always have the time to sit and get life stories. But sometimes I do as a resource. And I thought, I just want to talk to people. I've interviewed, a very good friend who lost her son to an opioid overdose at 18 years old. And now she's inspiring people, but they don't know the tragedy that she went through before. Or a good friend at work who's an ER nurse now in PACU, 32 years old. She found out she had cancer 6 months after her baby was born, and her mom found out she had pancreatic cancer a month after her wedding and died within a year. And my now friend, mother died, and now she's recovering from cancer, but would come to work happy. Most people didn't. She had a little hat on. Most people didn't know she had cancer. It's not something she announced. So everybody just like, God, all these people are so inspiring and they have these stories. That's why I wanted Call the Nurse. And Call the Nurse because, again, people are on the call like calling the nurse. They're not calling the doctor. They're saying, hey, can you call the doctor? Can you bring me water? Can you give me pain medicine? We're the ones that are there when no one else is there. We see it before the eyes and ears for the doctors. So that's really, that patient will always stick with me. Oh my God, it like makes me choke up. I think this is hormones. I just started HRT and I'm like, I'm like emotional all the time now. I feel like I'm pregnant again. I just hope that, she felt so listened to the day before she died.
Yeah.
I hope that she just felt someone stopped and didn't judge her for her addiction and just listened to her.
How
Wow.
I love well, first of all, thank you so much for your incredible heart and patient
Yeah.
care because
Thank
I think that's what like it truly is. I feel like everybody, the stress of life on both sides, patient and provider side, there's just such a lack of empathy and humanity behind healthcare at the moment. And so I appreciate your heart.
Thank you.
Yeah.
The world right now, right? The world right now is just chaotic, and it doesn't matter. It doesn't matter about presidents. It doesn't matter about politics. I don't even, none of that. Just the world it's hard enough.
Mm-hmm.
It's hard enough. If somebody is landing on my unit, they are not in a labor and delivery. They are not wanting to be there. They
Right.
are sick. Why make it harder? And I'll tell you one more story about my husband because I could do this with you guys all day. My husband is Israeli,
Okay.
and his first language is Hebrew,
Okay.
and October 7th was a big day for him, and it doesn't matter opinions, but for him it was, he's got family in Israel and he grew up there until he was 10. And the night of actual October 7th, he got a call like 3 in the morning. All he saw is the guy had a crushed pelvis. They needed to transfer him to a hospital where he could work on it, and they were giving him a hard time. He's like, "Listen, if you don't get this patient here, you need to do this surgery within a certain amount of time, or it's going to be very hard for them to walk again."
Mm-hmm.
And when he walked in, again, this is very fresh, day after, and this guy is tatted head to toe in Nazi tattoos, not nice things to say about Jewish people on his face, his eyelids, everywhere.
Wow.
And all he saw before was an x-ray, right? And I think in that moment, he had his Jewish star on. But in that moment, I thought he could have been like, this is too fresh for me, right? Like this is just too hard, dealing with this guy who is not really liking that I am his surgeon because I'm a Jewish man. Neither of them did that because it didn't matter, right? It didn't matter that my husband was Israeli. It didn't matter that this guy had been at some point in his life some kind of, Hitler guy and, white supremacy, whatever it was, none of
Mhm.
that mattered in that moment. He operated on the guy. I got a picture of them after, and the guy wept and just said, "Thank you. I would have never be able to walk again if it wasn't for you."
Mhm.
Now, will that guy go and do whatever he's going to do after? Maybe. But my
Maybe he.
husband and
Mhm.
that guy, maybe not, right? Maybe not. I just think there's so much behind a story when you walk in and you see whatever it may
Mhm.
be. That's not our role, is to kind of
Mhm.
judge in that moment. We still have a job. We
Yeah.
take care of people. And because of my husband, he did it. He did a great job. No one else would have been able to fix that pelvis. And that
Mhm.
guy is hopefully eternally grateful. And that, to me, that said a lot about him.
Yeah.
That said a lot about
Absolutely.
him and the other guy. The other guy could have been like, I don't want this, Jewish surgeon,
Yeah.
operating on me. It's
I think
humanity at that point.
I do. I think like, and that is something I don't think is spoken about very often is having to remove yourself and totally, I mean, just do your job, which your job is to heal and remove yourself from whatever that situation may be. I mean, I
Right.
actually recently had a surgeon who one of his colleagues in residency um, was operating on the gentleman who shot the girl on the train.
I stabbed the girl.
Oh,
That stabbed the
oof.
girl on the train. Sorry, yes.
Yep.
That stabbed the girl on the
Mm,
train. And it's
mm,
like,
mm.
I mean, how do you? That is so hard to know. Like, there are people that do come into your OR that have just harmed other people
Oh, yeah. I
intentionally,
mean, listen, we're in
unintentionally.
LA, right?
Yeah.
Oh
We had a
yeah.
shooting here on the 405, and the guy shot multiple cops a few years ago. We've had to shut down the hospital because the cartel is still looking for a wife or trying to kill the surgeon who saved the guy they were trying to kill. I mean, we go on lockdown, often.
Oh my gosh.
And
Oh
again,
my word.
oh yeah, it's cuckoo crazy out here. I just, again, the guy again who did this horrible thing to this girl, awful, terrible. That would be very difficult for me. But I also know how people judged me when I was going through my divorce, and they didn't
Mhm.
know what was going on behind closed doors, or they didn't know what was happening, or my daughter who didn't make great decisions at different times, or she seemed, or she should have done this, or my husband who didn't
Mhm.
make the best of choices in his marriage that he spoke publicly about on my podcast.
Mhm.
No one knows those things. So doesn't justify violence, right? But there's
Right.
Mhm.
still a story there. There's still
Mhm.
something going on, and we have a job as caregivers to take care of people. I mean, that's just the
Mhm.
reality. And if we can't keep that mindset, we're always going to have judgments on who should
Mhm.
get treated or who shouldn't, and having feelings about it. And we just can't, you know?
Yeah. Yeah.
Absolutely. So, if you could leave people like with one piece of advice or wisdom or anything along those lines that is getting into healthcare and wanting to, I don't know, lead and have the right heart like going into it, what would that be?
I always tell people, again, not even just in nursing, but just in relationships, you can't argue with humility. You can't go wrong with it. Whether it's your husband coming at you and you're just inquiring and seeking to understand, like, babe, that sounded kind of rough. What's going on? Instead of arguing, right? Arguing, you just start a fight. And I think when you're going into healthcare, you're going to see a lot. Like, you're going to see the worst of the worst. You're going to see bad attitudes. You're going to see, but if you go in with a heart of seeking to understand, even though we may not always understand it, or when you got that difficult patient who really tests you and you seek out humility rather than coming at someone, again, standing over them, what do you want? You're bugging me, or oh my gosh, like, what did you do in the floor again? Of like, I'm really sorry. That must be so, vulnerable. You did this in the bed, just approaching people with humility. It is not easy. Again, in that situation you're talking about, that would have been rough for me. But I think that you still got to keep a heart of humility. And I can get more from my patients and get them to be compliant if I am strong boundaries. Doesn't mean they walk all over you. strong boundaries, but seeking to understand. And they're not going to necessarily argue with you if you're humble with them. If you seek them and talk to them as a person. And I think when you've been a caregiver in the medical world a few years, you can start to lose this and start to see patients as patient in bed one and they need this and they're going for this procedure. They need their Dilaudid, they need their lunch, they need their AccuCheck. That's a mom in there who is just got the diagnosis of breast cancer. That's a dad in there who's been drinking his whole life, but his father abused him. Like there's just always a story. We can't lose that heart of humility. And we got our own stuff. All of us do.
Mhm.
I absolutely love that.
Yes.
I wanted to say thank you too, like for your heart that you have behind what you do. It's refreshing to hear because like you just brought up, like there are a lot of people that get, and I talk about this all the time, they get caught up in the monotony of just this is work, this is what I do,
Mhm.
collect my paycheck and go home. And so like to be able to like I have appreciated this conversation so much to like sit down and talk with someone who sees it from such a different
Mhm.
perspective. It's like just gives you, hope,
Mhm.
hope in the world.
And
Thank you. Well,
it's
listen, we do listen. I don't want to discredit that medical care hospitals. It's a business,
It is.
and
yeah.
sometimes nurses and medical staff they're not taken care of. I mean,
Mhm.
we're
Absolutely.
getting
Yep.
our
Yep.
really cute water bottles and pens for our appreciation, right? Or
Yeah.
Right.
maybe getting an In-N-Out burger for lunch. So I do get that we do have a system that does not appreciate us. But
100%.
we're still
Mhm.
caregivers and we're still nurturers, whether
Yep.
we like it or not. You went into this
Mhm.
role. And I do think there's a time to step out. I do
Mhm.
think there is a time to where it's just, but maybe you're doing this, right? You're starting a podcast and you're talking about other things.
Mhm.
Maybe it's not at bedside anymore.
Right.
Maybe it's doing online coaching, teaching other nurses, or maybe
Mhm.
who knows? It doesn't mean you have to lose the heart. There's absolutely a time that maybe you don't need to do it again because it is hard to be a nurse in this day and age right now. We don't get paid what we should. We're not appreciated,
Yep.
but you got to kind of look at the bigger picture of what your life looks like. So I do get it is not difficult. And they may say, "Oh, well, you work per diem and you're not there a lot." I've been doing this a long time. I probably
Yeah.
wouldn't have to work if I maybe didn't have to. I choose to. I love doing this. I love being with people. I would be bored out of my mind.
Yeah.
Yeah.
My husband would probably, I got two dogs here. I got a duck. I got a,
Duck.
I live in LA and I'm probably the only human that has a duck that's best friends with her dogs. So if I have a farm in Tennessee, I would love to be on my farm with horses
Yeah.
and cows, and I'm creating it here. I told my husband the other day, don't be surprised if I get one of those little baby cows, house
Do
cows,
it. Do
Yes.
it. Do it.
A
Yes.
Highland.
because I'm going to
I,
Yes.
take care of
yes.
something, right?
Yes.
I'm going to nurture something. So if it's not
Yes.
people, I'm going to drive somebody crazy and have like all the animals. But my duck Gigi, that's my
Gigi.
baby.
She is my kind of
I'll
girl.
tell you
Let
about
me
that
tell
another
you.
day.
That is
Yes,
awesome. Oh
absolutely.
my gosh. Well, Minnie, thank you so
Yes,
much.
thank you.
And I'm sorry that we weren't able to speak with Dr. Alon as well, but
We'll
we're
get him
looking.
on.
Yes,
He's
we
We
already
will
will.
get
texted
to.
me. Is it too late to join? Yes, it's too late to join. Sorry.
I
We'll
love
get him
that.
another time. Plus, he
Yes.
thinks it's a Zoom, so I'm like, we'll do it another time. You got to
Yes,
get him
Yes.
on because
we would.
he's got a great perspective, and we have a fun relationship.
Wonderful. Well, yes, we will definitely make that connection and follow up on that. So
Absolutely. Thank you guys. I appreciate all the work that you guys do. I really
thank
don't think you
you.
guys get enough credit. And to do something like this that's a little bit out of the box, speaking about these stories, I think it takes incredible courage and boldness. So you guys keep doing what you're doing.
Thank you.
Thank
You too.
you.
All right. We'll talk soon, Mindy.
All right. Thank you.
Bye.
Bye bye.